Hi everyone, welcome to your channel I Love Pharmacology. In this session, let us learn about bioavailability. So, what do you understand by drug bioavailability? A very important topic and very useful, high yielding topic that has been asked many times in your exams. And also, they have asked many previous year questions from this bioavailability, which is a favorite topic. So, bioavailability. So the definition itself says that it is the fraction of the drug which is reaching the systemic circulation in an unchanged form. So what is the definition? It is the fraction of drug. It is a fraction of drug reaching systemic systemic circulation in an unchanged form. In an unchanged form. So this is the basic definition you should never forget. So the key point here is the key point that one should remember is it is the fraction. It is the fraction of a drug reaching the systemic circulation in an unchanged form. Unchanged form. There should not be undergoing any metabolism in the body. So it is a fraction of the drug which reaches the systemic circulation in an unchanged form following the drug administration. So, how do you represent a bioavailability formula? So, it can be represented by a word F. F stands for a fraction. So, usually the bioavailability is calculated with the help of area under the curve divided by area under the curve. So the fixed here is area under the curve for IV route and area under the curve for oral. If it is subcutaneous, if it is IM, etc. So the denominator will be constant and this will be the constant one, constant, whereas the numerator may change according to the bioavailability which you are checking. So it is a fraction of the drug that reaches systemic circulation in an unchanged form, represented by represented by F area under the curve for oral or any other route divided by area under the curve for intravenous route. So which route has got 100% bioavailability? So whenever you give a drug, which is the route which is having 100% bioavailability? That means directly it reaches the systemic circulation without any metabolism or the absorption. So which route doesn't have absorption? Yes, it is the IV route, IV route. So 100% bioavailability is seen with the IV route. Which route doesn't have any absorption? Again the IV route. Which route has got the fastest absorption? Fastest absorption. So this is very tricky question. You need to remember. So the fastest absorption means, so please remember the drug which is having, the route which is having the fast absorption, fast absorption will be your inhalation. Inhalation route. But if they ask 100% bioavailability following the drug administration, it is IV route. If they ask which route bypasses the absorption, it is the IV route. Which is the route which has got fastest absorption? It is inhalation route. Is it clear? Fine. Next is the rate of drug absorption is represented by what? The rate of drug absorption is represented by the Cmax. It is the topmost concentration or the highest level of concentration that will be reached in a particular unit of time. The rate of drug absorption is represented by concentration max, Cmax. The extent of absorption is indicated by area under the curve, area under the curve. So please remember, these are very frequently asked MCQs. You should never forget. The rate of drug absorption is represented by Cmax. The extent of absorption is represented by the area under the curve. And area under the curve is very useful in calculating what bioavailability of a given drug. And which are the routes having first pass metabolism, and these are the drugs which are having low bioavailability. The drugs which undergoes first pass metabolism, that is the liver metabolism, is the oral route and the rectal route. Oral route and the rectal route. So how do you represent this form diagrammatically? So when you draw a graph, so this will be your oral route, and this will be your IV route. So this is the area under the curve. This is the area under curve. So this represents the area under curve, and whereas this one, this is the C max. This will be your T max, time taken to reach the highest concentration or the maximum concentration. So it is the maximum time which is taken to reach the maximum concentration. So this will be your dose, and this will be your response. So this will be your the response side, and this will be your the dose side. So this is the area under the curve. So this will be your area under the curve for oral route, and this will be your area under the curve for the IV route. IV route. So please remember, bioavailability 100% intravenous route. Which route has got low bioavailability? It is the oral as well as the rectal route. So two things you should remember: rate of drug absorption is dependent or represented by Cmax, whereas the extent of absorption is indicated by area under the curve. Formula is F, area under the curve for oral, or any other route divided by area under the curve for IV, which remains constant. And definition, you should never forget this word, that is unchained form. So this was all about the drug bioavailability. Thank you.